Hi there, me again, your friendly neighborhood humble stroke assaulter. So I'm going to do a bit of a response video. So I've got a couple new subscribers. One is Pamela Morgan Mitchell. Thank you for joining. I don't know how you found us, but thank you for joining the crowd. Another one is, where is it? Your username is "This stroke will not define me." So I'm going to assume by your content on your YouTube channel and by your title, you're also stroke folk. So you asked, in regards to a video I did on post-stroke fatigue, does it ever end because it's maddening? Well, I decided to do a bit more research about post-stroke fatigue. That being, when does it end? When does it get better? When does it get easier? When will things get a little bit less difficult? So let's just talk about that. And again, because this is a research video, I'm going to leave all the links down below insofar as the content that I've used for research. So I found one study, and I'll talk about that study mainly. That'll be the basis of the research. So there is a UK Stroke Association PDF about post-stroke fatigue. There is a stroke fatigue fact sheet from Australia. And then there's a study of 61 or 62 post-stroke fatigue studies or pieces of literature that were done. So fatigue after stroke is disabling and persistent symptom affecting many stroke survivors and is a predictor for death after stroke onset. Right? Post-stroke fatigue is multidimensional, motor, perceptive, emotional, and cognitive experience. It has become an interest for stroke researchers only in the recent past. So let's break down the medical speak to human. So it's multidimensional, meaning it will impact many different aspects of your life. It's motor perceptive, meaning not only how you perceive the world, but how you interact with the world. It's emotional. It can be either trigger emotions or it can be triggered by emotions. It's also cognitive, meaning how well can you process information. So post-stroke fatigue can literally impact or be influenced by what you do in the world, what's going on around you in the world, how emotional you get in the world, and how much thinking you have to do in the world. So essentially, you're screwed. So post-stroke fatigue can be described as a feeling of early exhaustion with weariness, a lack of energy, and aversion to effort that develops during physical or mental activity that is not usually ameliorated or lessened by rest. So you're going to have days with your post-stroke fatigue that just walking to the store can get you fatigued. Just getting out of bed can get you fatigued. Having to do something that would be very mentally taxing can get you fatigued. Something that would look relatively mundane, grocery shopping, can get you fatigued. So post-stroke fatigue often occurs after a stroke and has a negative impact on the rehabilitation process. There's been a bunch of studies. There's about 62 of them recently. And again, the study that I'm going to quote is mainly the lit review of those 62 studies. So studies have either focused on short-term or long-term post-stroke fatigue, the relations to the stroke characteristics, right? Risk factors such as depression, pre-existent white matter lesions, brain atrophy, right? However, the exact precise mechanisms that are the root cause of post-stroke fatigue are really unclear. The exact reason why your fatigue will present the way it does, get worse or get better the way it does, there's no definitive benchmark, right? Only one study has reported that fatigue can be more severe after an ischemic stroke than a hemorrhagic. There are no specific scales for measuring fatigue after stroke. So it's not like you can go to your neurologist or a neuropsychologist or a psychiatrist or your general practitioner or even a social worker and ask them to do some kind of post-stroke fatigue assessment. There are fatigue measuring scales, but they're not specific for stroke. They're just fatigue scales, and there's various out there. I'm not going to get into what they are because that's not really germane to this conversation. And then even then, some of the data can be a bit contradictory. So there was a group of researchers known as Christensen et al., and they showed that 59% of those that have had stroke had fatigue after 10 days. 44 of those that had stroke had fatigue after 3 months. 38% that had fatigue after stroke at the 1 year mark, and 40% had fatigue at the 2-year mark. It's kind of interesting. It dips down and then back up again. Right? And all of those are following the onset of a stroke. Another study found that the prevalence of post-stroke fatigue was 35% 2 months after the stroke and 33% at 1.5 years after the stroke. So that's a little bit different. Radman et al., another study reported similar results at 6 and 12-month intervals following a quote-unquote minor stroke. At 6 months, 30.5%, and at 12 months, 34.7% reported fatigue after stroke. And another longitudinal study showed an increased percentage of self-rated fatigue at admission, as well as 6 months, 1 month follow-ups. So 51.5% at admission. So you're just at the hospital, right? And you just had your stroke. So 51.5, a little over half. At the 6 month mark was 64% or 64.1, and at the 1 year follow-up was 69.5. So all of those numbers bounce around a lot. So at the 1 year mark, one study says 69%, another study says 34%, another study says 35%, another study. So even the studies don't have, for some reason, the ability to get concrete numbers that are clear and concise and don't have some level of ambiguity. It'd be interesting to see why those studies give such drastic differences in numbers. If I have the mental acuity to actually dig through those studies and try to figure out why, I might do a video about that, but that'll be in the future. So there's a strong relationship between depression and post-stroke fatigue. So the problem is you have to help make the determination between fatigue and depression. So when you are depressed, you can be highly fatigued. When you have post-stroke fatigue, you may also have depression. So for those of you that are going through post-stroke fatigue, you've now got to make some of that determination. Is this post-stroke fatigue and post-stroke depression? That would be the worst case by far and large. Or is this post-stroke fatigue that looks like depression, or is this post-stroke depression that has fatigue involved in it? So which one of those three do you fall down into? That's where you're going to need to have a very skilled clinical team. You're going to need a neuropsychologist or a psychiatrist that has some definite specialty working with stroke folk, brain injury, acquired or traumatic, and they have the ability to slice the pie where it needs to be. How much of that pie is depression? How much of that pie is fatigue? And then let the experts help make that decision. Right? There was a Danish study that analyzed the course of fatigue over a 2-year follow-up after a first stroke. Post-stroke level of fatigue was seen to decrease during the first 3 months after your hospital discharge, and that amount relatively remained unchanged over a 2-year period. Different findings have come from a study by Scheppers et al., who reported an increase in prevalence of fatigue during the first year after a stroke. The difference could have been explained the fact that Schlepper's study had a higher number of people that were reported to have had depression in it. So right there is some correlation between depression and fatigue. Several studies in fatigue in general population have reported fatigue in general tends to be higher among women. There are some conflicting studies, some saying that post-stroke fatigue is more prevalent in women, and some are saying that there's no difference between the sexes. So men and women get it equally. Some studies say women get it more often. Again, we end up in a situation where the experts are going, in some cases, going to give you a very fairly highly educated, very expensive guess, right? Because even the experts right now, I've quoted several different studies, and some of them contradict each other or come relatively close, but not. So fatigue after stroke is a multidimensional symptom that may have several causal factors. Currently, there's no evidence-based interventions that can successfully prevent or treat post-stroke fatigue. So basically, they can't predict it. They can't effectively diagnose it. It's mainly going to be self-report, and they don't really have any way to help prevent it. Now, there are some treatments, and the treatments can help alleviate the fatigue. They're going to help you manage your fatigue. At present, there is no cure for post-stroke fatigue. So if you are in the population, like myself, that it has post-stroke fatigue, you got to suck it up. There are going to be ridiculously wretched days, and there are going to be even better days. So just keep in your mind, the only easy day was yesterday, the only better day can be tomorrow, and if you're having the bad day, do what you can to make your day better. And in some cases, that means bed, toast, and tea. Right? So you can manage or treat your post-stroke fatigue with pharmacological, meaning drugs. You can treat it with physical activity, and you can treat it with psychological treatments. So we'll discuss each of those briefly, right? Because remember, I'm not a doctor, only played one on TV. I'm just a guy who's got a little bit of education, a little bit of experience working with brain injured folk before my stroke, and then now having had a stroke and can Google things. So basically, you've got to find out what is causing your fatigue, and we'll get into more managing your fatigue later. So you can do physical treatment for your fatigue. Initially in the hospital, that's going to look like you and your physiotherapist or you and your occupational therapist. Now that could be anything from, going to the gym, that could be getting outside and walking around, that can be doing anything that is a physical activity to try to get you motivated and activated. Pharmacological treatments, drugs, right? There is no specific chemical treatment for post-stroke fatigue. I myself, I have a medical marijuana license here in the province of Ontario in Canada. It is prescribed by a doctor. It is completely legal. I have a CBD oil, which has no THC or narcotic effect to it. And then I have a CBD THC 1-to-1 combination oil. Both have different effects. Both have been highly effective. And if you are in a jurisdiction where medical marijuana is legal, I'm saying this completely so there's full disclosure, where medical marijuana is legal and you're not violating any laws, you may want to approach your clinical team and have a conversation about it, see if it is the right solution for you. Right? Then there are psychological treatments. You can go to a social worker, registered therapist, psychologist, psychiatrist, someone who is also not only skilled in that area, but has experiential education and practical experience working with brain injury. So they will have a better understanding of what fatigue after stroke looks like. And then environmental suggestions. Now, what I mean by suggestions, simply that. Getting out, being active in the sunshine, getting out, being active in the world, being active with friends, getting motivated to do activities that you used to do before your stroke and trying to continue to do them after your stroke. Because if you can get out and try to recreate a very similar lifestyle and pattern of living that is very similar to your pre-stroke world and your post-stroke world, well, there you've got physical treatment and psychological treatment rolled into one, right? You can do both simultaneously. And I have a whistling bird right over there. Come here, buddy. Come here. Okay, stay over there. So, and with the environmental suggestions, that includes physical activity, proper nutrition, adequate rest, and relaxation. Now, you can do some things to manage your fatigue. You will find all of these listed in the PDF from the UK Stroke Organization about managing fatigue. I'll go through some of them. So being tired after a stroke is fairly common, and you got to remember, first off, it's not your fault. Right? You are in no way at blame for being fatigued after a stroke. So try, and I still suffer from this, try not to take it out on yourself or be too hard or difficult with yourself, because you just can't do things. Right? The fact that you're tired may not be obvious to other people. Like, they're not going to understand that you get tired quickly, or certain situations or events or activities just drain you right out. So you may have to show them some some of the documentation I've included or documentation from other places, so they get a better understanding of what the inconsistencies of post-stroke fatigue can look like. You want to give yourself plenty of time. It can take many months for post-stroke fatigue to start to lift. I'm going to be honest. I had my stroke in June. Things started to get better in October-ish, and it wasn't until I got my medical license and started taking the oils, things got drastically better. Now, is that a combination of 5.5 months post-stroke, or is that a combination of the medication, or is it a combination of both? I don't know, because I don't intend to have another stroke again, just to find out. Right? You may want to keep a diary. And if I had to do this all over again, not that I ever intend to, because the first time was shitty enough. If I had to do this over again, I would be more conscious about journaling and keeping a diary. So, because it gives you a good benchmark of what you could do one day and can't do another. Now, I did start journaling fairly regularly in my initial 3-4 weeks of my return to work, because I needed to try to find benchmarks and relationships to what caused me to get fatigued. And that actually was a very worthwhile exercise. Right? And then the one I suffer from, and I've yet to learn the lesson effectively, don't push yourself too hard. Right? If you're having one of the better days, right, and they happen eventually, you get days where it's like everything's excellent. The sun is up, you can move, you have no problems about being active or staying active. Right? On those days, just find the happy medium and stay there. Don't try to push it, because as soon as you try to overdo what you think you can do, you're going to end up on a couch or in bed, curled up in just a hurting ball of goo. Right? In that case, listen to your body. If you start to feel exhausted, take a break. Right? Now, I'm not going to go through all of the steps here to manage your fatigue, because there's a whole bunch of them, but you'll find them in the list. I'll leave them in the description down below. Right? So at that point, you can get a better idea of what that looks like. But just remember, post-stroke fatigue is a common, complex, multifactorial syndrome that is poorly understood regarding its pathology, its clinical characteristics, and its associated factors. So what that means from medical speak to human, they don't have a clue. Right? It's common. So, I mean, a lot of us get it. In some cases, 60-some%. It's complex. It can affect your memory. It can affect your thinking. It can affect your mobility. It can affect your balance. It can affect your level of attention. It can affect your level of concentration. There's so many things post-stroke fatigue can impact, right? And the reason why people get it, what it does to your body, what it does to your brain, is very, very poorly understood. What they do know is this. Studies have reported that post-stroke fatigue is an independent predictor of shorter survival, institutionalization, poorer functional outcome, and greater dependency for daily living and instrumental activities of daily living. So, if you get fatigued quickly and more often, I'm not saying this to scare anyone, but just the reality of the situation, there are potentials, and I say this is potentials, this is not every case. There are potentials that, yeah, maybe your survival length after the stroke may be impacted. But then again, I know of people that are 13, 14, 20, 25 years after their stroke. So that doesn't necessarily mean that that is the case. And just remember this. Whether you get fatigued immediately after your stroke, or whether that fatigue shows up 1 year later, the majority, almost 2/3 of people that have had a stroke are going to have post-stroke fatigue. All I can say is that post-stroke fatigue does exist at least up until the 2-year mark. Unfortunately, it is a poorly studied event. There aren't a lot of researchers doing research on this beyond the 2-year mark, so what research there is limited. If I can find a better resource that indicates what goes on with stroke after 2 years, definitely I'll do an update video to this. But post-stroke fatigue, it does exist. Unfortunately, the research is not clear. The studies do contradict each other. All that you can do is take the good days for what they are, the better days for what they are, and the crap days, tea toast in bed, right? And try not to be hard on yourself, because it's not your fault that you've got post-stroke fatigue. On that note, if you like what you've been watching over the last 10 months, please like, share, subscribe. If you happen to know someone going through their own post-stroke journey, please point the channel out to them. They might get some value out of it. If you know someone supporting someone going through their post-stroke journey, please, again, point the channel out to them. They may as well get something valuable out of that, like today's video on post-stroke fatigue. And if you either happen to see either in yourself or someone around you the signs or symptoms of a stroke, that being someone who appears to be befuddled or confused or having lack of balance, someone who has vision problems, they can't see out of one eye, they only see in grayscale, they can't move their eyes in one direction, they only see a little dot in the world, someone who has facial droop, someone who can't raise both arms equally effectively or at all, someone who can't smile equally effectively or at all, someone who has slurred or stuttering or inappropriate word usage for situation or context, someone who has general body weakness, weakness on one side, or has the inability to stand unaided, please immediately place that person in a position of comfort and dial 911. Something so simple can save a life.